Hello, I'm Shin Sang-ha, a neurosurgeon at Wooridul Spine Hospital. Are you waiting for summer vacation to undergo spine surgery? At Wooridul Spine Hospital, you can get treated in just one day without using up your vacation. Traditional spinal surgeries involve procedures like laminectomy, which removes bone and leaves large wounds, leading to slow recovery. In contrast, our endoscopic treatment doesn't remove bone and preserves normal tissue as much as possible. This is why recovery can be quicker, and this advantage allows for rapid treatments. Like our 2-day clinic, the average time from admission to discharge is about 24 hours. This makes it easy for busy office workers or students to get treatment without much burden. Patients who have pain often feel significant relief immediately after treatment. You can resume daily activities such as sports, labor, and sexual activity. Most patients who had their normal lives restricted by pain can live without discomfort after the procedure. Since the treatment is done through a small incision for the endoscope, there is almost no visible wound. The area is covered with special tape, and you can be discharged. Therefore, there is no need for follow-up visits specifically for wound care after discharge. The small incision results in less bleeding and reduces the risk of infection naturally. Because of the minimal incision, there is less pain and a smaller scar, which leads to higher patient satisfaction. The procedure is performed under local anesthesia while communicating with the doctor, not under general anesthesia. Thus, patients can feel at ease, and even elderly patients in their 70s and 80s can safely undergo the procedure. Since the endoscopic treatment only targets the affected area and doesn't remove bone or muscle, there are almost no complications such as instability. Because it's done through a small hole, there's almost no bleeding, and the procedure is constantly irrigated with a saline solution, which includes antibiotics, reducing the risk of infection to a minimum. Therefore, there are almost no complications related to endoscopic treatment, and you can safely undergo the procedure. Moreover, since the spinal nerves are not touched, there is minimal pain during the procedure, and complications like nerve adhesion rarely occur after treatment. Recently, a famous actor was injured while filming. The actor underwent an urgent procedure and was discharged later that day. One particularly memorable patient was a renowned artist who had traveled to many countries, including France, Japan, China, and Korea, for treatment but continued to suffer from pain. After receiving the 2-day endoscopic treatment at our hospital, his symptoms improved significantly, and he was able to hold an exhibition and perform magnificently, which I later saw in the news. I also have medically treated a national baseball team player. After his treatment, his symptoms improved, and he won a medal at an international competition, which was very rewarding for me. Most of our patients also come through referrals, including many doctors. We have treated dozens of doctors specializing in spinal care neurosurgeons, orthopedic surgeons, and pain management specialists who were mostly very satisfied with the results. However, the outcome of the endoscopic treatment varies greatly depending on the skill level of the practitioner. Therefore, it's better to receive treatment from doctors who are experienced and have worked in well-established institutions. Additionally, precise medical equipment, such as high-frequency devices or endoscopic lasers, is necessary. Having well-equipped facilities with the right equipment can lead to the best results. People who have had spinal issues for a long time often fear surgery. They sometimes live with pain rather than undergoing surgery. However, a variety of techniques and technologies have recently been developed. Therefore, this 2-day endoscopic treatment can effectively treat almost all patients with disc issues, as well as conditions like spinal stenosis or foraminal stenosis, with the majority experiencing successful outcomes following treatment. Don't be afraid. Active treatment can free you from pain and suffering.